Good day everyone, my name is Mark Garcia and today I'm going to show you the procedure, the process of subcutaneous medication. But before that, we have to check the doctor's order, check the medication administration record, check the label of the medication carefully to make sure that the correct medication being prepared. We have also to do the 3 steps of checking. First one is to read the label of the medication, when it is been taken, the medication, and also before and after withdrawing the medication. Alright, now organize all the equipment that you need, which is I had here. I prepared 1 cc syringe here, and also I also prepared the insulin syringe just to show you. And also I got here couple cotton balls, and also the band-aid, and also the antiseptic alcohol pads to clean up the area of my client where I'm gonna inject it. And also I prepared also vials here as my medication. And also I got my gloves, and also my book and my pen for the record. And also I had a alcohol for the hand hygiene. Okay? Now I'm going to perform my hand hygiene by simply washing my hands to avoid cross-contamination and even infection to my clients. I have my medication syringe ready, which is I got here right on my side. Take note, if you're mixing the meds or the vials, you don't have to shake it like this. You cannot shake your medication like this. That's could possible fall. Instead, use your both palm and do like this, and just rotating it. Remove the cap on the vials, which is mine is already been removed. So what should I do is to clean it with antiseptic from inside to outside by a rotating position or circular motion. If the medicine have been previously open already, I'm going to withdraw the medicine by inserting air of the vial to desired amount of the medication that I'm going to take out from the vial. So I will insert, let's say, I will insert like 3 cc of the medication. So I had to insert also air, 3 cc, to make it more easy to reduce or to take out the medication later on by then. And then, and take note, we don't have to put the needle inside the vial like all the way, but you have to ensure that the tip of the needle is below to the fluid level. I'll show you. Okay, I'm gonna recap my syringe, and then I'm gonna insert my needle to the vial, and then I'm gonna put an air first. Before I'm gonna insert it, I'm gonna put air first. Like for example, this is a 10 cc syringe or 1.0. So what I should do is like insert this to my vial. Gotta insert this to my vial, and then release the air, and then take it out, and then you have to put it back, and then you could release the 1 cc of the medication. Or take out the 1 cc of medication. Okay? And then you have to recap it, but don't use 2 fingers. You cannot use 2 hands by recapping the syringe. Just simply like a fishing hook. And then you could do it that it's more easy. Alright? Now I'm going to face the patient and explain all the procedure that I'm going about to do for her. Alright, ma'am, good morning. My name is Mari Garcia, your student nurse for today, and today you're going to have a subcutaneous, which is we're gonna do it to your arm. And are you comfortable on your sitting position right now? Yes, ma'am. Can you tell me about your name and also your date of birth, please? Okay, let me show you your wristband. Thank you, ma'am. Do you have any question or any clarification before we're going to start? Alright, ma'am, is it okay to you that I'm going to close the door so for you to have a privacy and so that nobody could distract us during the procedure? Okay, ma'am, thank you. Take note, avoid using the part of having a lesion. Don't inject there. A lesion, a tenderness, a swelling to have a better result. Now I'm going to wear my gloves as an agency policy and clean the area, which is the forearm with a circular motion. But before you're gonna clean his arm, you have to wear your gloves first. Now I'm gonna get my antiseptic pad to clean the area of the arm of my client. Again, do not like rub it. Do the circular motion. Like this one. Show you. From inside, going out. And then, discard. While waiting to dry the antiseptic, I will remove the cap of my syringe and exhale any air bubbles from the syringe. Okay, when you're recapping it, you could do like this, or you could do like this. One hand. I could recap in one hand. And then, I'm gonna exhale. As I could see, there is as you could see, there's expels bubbles here. There is a bubbles, and you have to expel that. Any air bubbles, because any air bubbles could be plunger could be adhered to the plunger are no consequences. Okay, I release now all the bubbles. I'm going to grasp the syringe with my dominant hand, this is my dominant hand. Actually, I could also use my other hand. I'm on the left-handed, but I am comfortable in this right. So I assume that this is my right. This is my dominant. So on my dominant hand, I'm gonna grasp the arm of my client, which is I'm gonna inject this to his arm, and then I'm gonna do it like this. No, like this. And then in 45-degree angle, I'm gonna insert it the medicine. I'll show you. This is the 45-degree angle. I'm holding like this because I am very comfortable of how I'm holding my syringe. And then insert it, and this is 45, and release the medication or the medicine slowly. And then you don't have to pull right away. You have to wait at least 5 to 10 seconds, and then pull out really gently. Now, if there is a blood coming out, all you have to do is give some pressure, not too pressure, just enough pressure that is gonna stop the blood. And then you could cover this with a band-aid. Take note, do not massage the area. You cannot like shaking it and massage it. Just if there is a blood, you can see blood, then put a cotton or the dry cotton, and then cover it with a bandage, and eventually will stop. Now that I am done with the procedure with my patient, I will remove my gloves and discharge it properly. I will perform my hand hygiene and also say thank you to my client. Hello, ma'am. We're done doing our here, subcutaneous. And how you feel? Do you have any question or any clarification for that? Ma'am, if you feel like any discomfort or any changes, please do not hesitate to tell us right away. Okay, ma'am? Thank you. Now that I am done with my subcutaneous, let me show you a quick video of the insulin, because I got here an insulin syringe. I'll show you how to do it on the stomach or on the tummy area. We had a safety lock here. We gotta remove that one, and also this one. Now, if we're going to inject a syringe, or not syringe, an insulin of the stomach, rest assured, if your client is thin or skinny, you have to pinch the skin, not the skin, the dermis. You have to do it like this, and then inject it in 45-degree. And then, but if she's had a good fat, you don't have to grab the epidermis or the dermis. Just inject it right away. And that's all for today for my subcutaneous. Thank you for watching.